How long have you been a neonatologist?
Over 30 years. And what worries me now the most is that the infections that I would routinely treat in babies at the beginning of my career with antibiotics, now we're seeing more and more of these bacteria that are resistant to those types of antibiotics, and we're having to use newer, different antibiotics, some that haven't been studied adequately for safety and efficacy in the babies, yet we have to use them because there's no other choice.
So the problem's getting much worse.
As we see more and more bacteria in the babies that are resistant to these antibiotics, the question is, will we have antibiotics to treat the serious infections when they occur in the future?
You're worried that you'll see a day when a baby arrives here in the premature unit and she has an infection that you just can't treat.
Correct. That's what we're worried about in the future, and we're trying to prevent that as much as possible. And we know that if we can control the numbers and amounts of antibiotics, the time we're treating them with antibiotics, that reduces the risk of a more serious infection later on.
Have you lost babies in this hospital because of drug-resistant bacteria?
The answer is yes. I'm afraid to say that, and it's happened to me throughout my career. And I think all of us at almost any newborn intensive care unit in the United States are facing these same problems. We've all lost babies to serious bacterial infections. And when that happens, your inclination is to treat more babies with antibiotics, when in actual fact, we probably should be treating less babies with antibiotics.
It's a terrible conflict, isn't it? That what might be best for the individual baby has a detrimental effect on the community.
Correct.